Of course, name is Mark Richardson. I had the pleasure of authoring Health Canada's assessment of mercury exposure from risk assessment. The report was released by the department in 95, published it in the literature in 96. I had worked for Health Canada since about 1987, and in 1992, got an opportunity to go back to school, get my PhD, which I'd wanted to do. So I studied mercury for my PhD, and when I returned to the department in 1994, rather than going back to my original job, which had been held for me, which was kind of them, they said, we have this material, we would like a risk assessment done of it. And I asked, well, what's that? Well, it's dental amalgam. And not knowing anything about it, asked a few questions, was told that it was mercury, it contained mercury, which I had not known before that. And of course, having spent the last 2 years of my life studying mercury and the environment, exposures and everything else, it was a bit of a surprise. And of course, as most biologists, toxicologists view mercury, it's one of those toxic elements that most of us believe we should reduce exposure to. So I said, sure, I'd love to do that study. So I spent the next year of my life learning everything I could about dental amalgam, mercury exposure from the amalgam, reading all of the toxicological literature I could find. The department was very, very supportive. One of the things they required me to do was to meet with anybody and everybody who wanted to meet me to have some kind of input or know what was going on. So I met with many Canadian members of IAOMT, Murray Vimy, Fritz Lorscheider in Calgary, formulated all of this information, did the exposure assessment, and part of that process was to develop an appropriate reference exposure level for the mercury vapor or the mercury from dental amalgam. We concluded in the end that mercury vapor was the primary concern. And lo and behold, of course, that it didn't sit particularly well with the department. One of the problems was I was terribly naive when I did this study. Like I was more or less fresh out of university, very, very idealistic. We identify risks, we try to control them and all of this sort of stuff. And I had a reporter from the Calgary Herald call me up one evening, just towards the end of the day. And rather than deferring him, because the rules about how to deal with reporters is much more strict and regimented in government circles now than it was back then. We're talking about 94. So he engaged me in a conversation for probably a good hour. And the next day is a headline in the Calgary Herald stating that health official considers limits for dental amalgam. And I'd never told them that I was working on trying to define limits for dental amalgam, but I told them that I was assessing exposure and then setting the reference dose, and I was going to compare the two. And he just sort of read between the lines and had this headline. That was the beginning of the end of my relationship with Health Canada. It did create some problems with the Canadian Dental Association, as you might guess. When I finished the report, handed it on the 15th of August, 1995, I'd had enough with the department and all of the problems, and starting on the 18th, the Monday, the 18th of August, with a private sector firm, do risk assessment. And all hell broke loose. The Canadian Dental Association was rather derogatory towards my work in the national press and on the 9 o'clock or 10 o'clock news, which is sort of big in Canada. Health Canada at the time didn't have a dental advisor, if you will. So I was pretty much on my own. It was an issue specifically for the segment of the department that I worked in. They didn't have anybody else working on it, and you were left pretty much on your own. In the U.S., you have to look at its relative scale here. There's, 10 times more population. There is more funding available for this sort of thing. So where the U.S. might put together a panel of 10 or 20 experts to do a risk assessment, in Canada, it's one person. And it's always been that way and always will be. I don't necessarily think that's bad, but it's just a different approach to things. So you were just pretty much left on your own to work on these things. During the process, like I said, I flew across Canada to meet with various people interested in the whole issue. I have to admit that the only people really interested in meeting were members of IAOMT and others. Fritz Lorscheider and Vimy Murray had been doing research in Calgary on the issue. Canadian Dental Association really wasn't interested in meeting. They didn't raise a fuss until they read the article in the Calgary Herald, of course. But Folks in the US had gotten wind that I was doing this work. I can't really tell you now what event sort of triggered that involvement, but I was contacted by Rod Mackert, who was here at these proceedings today. He was representing, I don't know what dental amalgam manufacturer, but they flew him up not once but twice to meet with me, along with a couple of lawyers, just to sit down with me and talk about my research and where it was going, to find out what I was doing, what I was thinking, maybe to offer some assistance if I needed it. I don't know. But like I said, I conducted both of those meetings with one of my staff in the room. I just, but let's keep it all on the up and up. I'll just have somebody from my staff sit on this so that we have a record. And I had her keep the record of our discussions and everything. At one point, I know I was in, it was down in Arkansas at a conference. I forget where in Arkansas now, but there was a conference on Mercury down there, and I went down and I made a presentation. I had a poster, basically, of the work I was doing. And there were people from both the American Dental Association and Canadian Dental Association at that meeting, just poring over this poster. It was very, very interesting. Probably career-wise, the most significant thing I've ever done in my life. It certainly set the tone. I handed in that report on the 15th of August. It set the tone for my career, probably for the next 10 years. And I've continued to publish in the area. Basically, it's what's brought me to Washington, D.C. for this meeting, because of the work I did back then. Basically, I went through all of the literature trying to get a sense of what the exposure, how much exposure occurs as a result of dental amalgam. And there wasn't a lot of information available on it. And the information that was there just said, well, it would go from 1 to 17 micrograms, or it was an average of about 5 or 3 or whatever the number was. There were a few publications, but nothing very specific. So I applied at the time a new technique in risk assessment. It's called probabilistic risk assessment. Basically, you attempt to predict the full range of exposure from the least to the most across the population, with an indication of the frequency of the population that falls into any category of exposure. So you always have a lot of people that have low exposures and a few people that have high exposures. So I applied it. It was really the first regulatory risk assessment that was done using probabilistic techniques in Canada. Applied that method, basically concluded that exposure averaged around 3.5 micrograms per day. And the safe dose, what would be viewed as a reference dose or a reference exposure level, was around 1 microgram. So the average exposure exceeded what I'll call the safe dose by about a factor of 3 to 3.5. Maximal exposures was probably on the order of 8 to 9 times higher than that safe dose. That was really the thing that created all of the problem. I attended a meeting on behalf of Health Canada. I was representing Health Canada at a meeting in Germany. It was an international meeting. I was there representing Canada. The host country, Germany, had 3 representatives there. The US FDA arrived with an entourage of about 7. They were the most represented at the group, of the countries at this meeting. They had a closed-door meeting. They were going to record it, which was quite, was normal for the time. You would record a meeting so that you could prepare minutes of the meeting afterwards. And I participated. I was the secretariat, if you want, or as a secretary for a number of risk-based committees in Canada for about 2 years. And routinely we recorded the proceedings so that my minutes of those meetings would be accurate and you could go back and check. Well, the German representatives wanted to record the meeting so that they could create an accurate record of the minutes. And it's partly because the meeting was held in English, which wasn't their first language, and I could totally understand it. It was requested that the meeting not be taped. Can't remember if it was the US or the British representatives who asked that the meeting not be recorded. And I didn't object. They went around the table. I had no problem with that. It really didn't bother me at the time. Like I said, I'm a little naive. They went around the table saying what people thought about the exposures and risks and everything. And everybody else had basically said, well, we've got some idea of exposure, but we really can't do a proper risk assessment, etc., until they got to me. And I said, well, sure you can do a risk assessment. I said, you calculate, you determine what the exposure is, and you determine what a safe dose is. And there were standard procedures back in 1994 for setting safe doses or reference doses, whatever you want to call them. And I said, you simply compare the two. Honest to God, you could have heard a pin drop after I said that, because it's the last thing that they ever wanted, was to do a proper risk assessment where you were comparing estimates of exposure to a safe or reference level. I refuse to make any claims of complexity or that I've done anything untoward or weird or wild. All I did was a basic risk assessment. And the only thing I've done different from everybody else is really to do that straight comparison of the exposures to what would be considered a safe or reference level. And in every case I've done it, this is now probably my third in various stages, exposures always exceed that safe dose. That's one of the problems with the whole issue of dental amalgam, is the levels of exposure far exceed what most regulatory agencies would be considered a safe dose.